The UK is teetering on the edge of an economic crisis, and it's not just about numbers, it's about people. A staggering £85 billion is lost annually due to sickness-related absences, a figure that's not only alarming but deeply personal, as it reflects the struggles of millions unable to work due to health issues. But here's where it gets controversial. While the problem is clear, the solutions are sparking debate. Is the government's approach enough, or are businesses being left to shoulder the burden alone? According to a recent report led by former John Lewis boss Sir Charlie Mayfield, the UK is facing an economic inactivity crisis with 800,000 more people out of work due to health conditions compared to 2019. This isn't just a statistic, it's a ticking time bomb. Without intervention, another 600,000 could join them by 2030. Sir Charlie emphasizes that this isn't inevitable, but fixing it requires a radical shift in how we view health and work. He argues that health should be a shared responsibility between employers, employees, and healthcare services. But is this realistic, or just wishful thinking? The cost of sickness goes beyond the workplace. Employers lose £85 billion annually through lost productivity and sick pay, but the broader economy suffers too. Weaker growth, higher welfare spending, and increased pressure on the NHS are just the tip of the iceberg. Sir Charlie puts it bluntly, work and health are mutually reinforcing. Keeping people employed doesn't just benefit businesses, it helps individuals stay healthier. Yet, 1 in 5 working-age people are currently out of work and not seeking it, a trend that threatens the nation's prosperity. Take Loz Sandom, for example. At 28, with a degree in illustration and experience as a digital marketing executive, Loz is eager to work. But mental and physical health conditions have made finding a job nearly impossible. I want to find a job, Loz says, highlighting a key issue: many employers don't realize their duty to provide reasonable adjustments for disabled workers. Are businesses missing out on talented individuals because of a lack of awareness or support? Loz doesn't blame employers entirely but calls for systemic change. They need support too. The government has responded with a major partnership involving over 60 companies, including Tesco, Google UK, Nando's, and John Lewis. Over the next 3 years, these firms will develop workplace health strategies to reduce sickness absence, improve return-to-work rates, and boost disability employment. The goal? A voluntary certified standard by 2029. Work and Pension Secretary Pat McFadden calls it a win-win for both employees and employers, but critics argue it's not enough. Is a voluntary standard truly sufficient to address a crisis of this scale? The CIPD, representing HR professionals, supports the government's preventative approach but warns that success hinges on businesses understanding and policymakers backing these recommendations. Meanwhile, Labour's Employment Rights Bill, which aims to protect workers, has faced criticism from some businesses for potentially disincentivizing hiring people with illnesses. Is this bill a step forward or a barrier to growth? Adding to the debate, Chancellor Rachel Reeves plans to guarantee paid work for young people unemployed for 18 months, with the threat of benefit cuts for those who refuse. Is this a fair solution, or does it place too much pressure on vulnerable individuals? As the UK grapples with this crisis, one thing is clear: the status quo isn't working. But what's the right path forward? Is it more government intervention, better business practices, or a cultural shift in how we view health and work? The answers aren't simple, but the conversation is essential. What do you think? Are we doing enough to tackle this crisis, or is more radical action needed? Let's discuss in the comments.